Echo TV is a co-production of Minnesota's Emergency, Community, and Health Outreach Collaborative of Health, Safety, Emergency Preparedness, Ethnic and Nonprofit Agencies, and TPT's Minnesota channel.
Hello and welcome to ECHO, Emergency, Community, and Health Outreach. I'm your host, Lillian McDonald. ECHO brings you information on health, safety, and emergency preparedness topics. This time we're going to talk about understanding colon cancer. We have a guest who will answer some questions about the subject, but first, to get a basic idea of what we're talking about, please watch this.
Each year, about 150,000 people in this country are diagnosed with colon or rectal cancer. Close to 50,000 people in America will die of the disease this year. It's a tragedy made worse by the fact that many cases can be prevented. Today we'll show you why it's so important that both men and women get tested for this disease, beginning at age 50. The colon and rectum are parts of our intestine. They help package waste materials from the food we eat. Like the rest of our bodies, the colon and rectum are made up of tiny building blocks called cells. Just like bricks build homes, cells build our body. But sometimes these cells grow out of control. When cells grow out of control, they may become cancer. A cancer that begins on the colon or rectum is called colorectal cancer, sometimes just called colon cancer for short. Colon cancer is common. In fact, it is the second most common cause of cancer death among men and women in the United States. Some people think that only men get colon cancer, but women get it too, and chances of having it increase as you get older. And if you have family members with colon cancer, you may be at an even higher risk. Fortunately, you have the power to keep colon cancer out of your life. Here's how. Most colon cancer starts with a growth called a polyp that is not yet cancer. Testing can help your doctor or healthcare provider tell if there is a problem. Some tests can find polyps before they become cancer. Most people who have these growths removed never get colon cancer. So, how do we test for colon cancer? There are several ways. Here are two of them. A colonoscopy is a test that allows your doctor or healthcare provider to find colon cancer early. The doctor uses a lighted tube to look inside your colon. If your doctor sees something that is concerning, he or she can take a piece of the growth and test it for cancer. The instrument can also remove polyps, which can prevent colorectal cancer from developing. Another test is a simple card that you can take home with you. You take a small piece of your stool and put it on the card where indicated. You do this for 3 separate bowel movements, so most tests take 3 days. After you get all the cards completed, you can take or send them to your doctor's office. This test will tell the doctor or healthcare provider if there is any blood in your bowel movement. If blood is found, a colonoscopy will need to be done. There are other tests that find polyps and colon cancer. Ask your doctor or healthcare provider to help you determine which is best for you. Most colon cancers occur in adults who are 50 years old or older. That's why it's so important if you are in this age group to get tested, and encourage friends and relatives who are over 50 years old to get tested as well. And if your doctor or healthcare provider does not mention getting tested for colon cancer, don't be afraid to ask about it. In the past, we didn't know much about cancer. Now we've learned a lot. We know that some cancers, like colon cancer, can be prevented. If we can prevent cancer, we will not suffer its consequences.
Welcome back. You're watching ECHO, Emergency Community Health Outreach. It's a health, safety, and emergency preparedness program, information that we produce in multiple language. This broadcast in English. I'm your host, Lillian McDonald. Our subject, understanding colon cancer. And joining us to talk about this subject right now, Dr. Mark Yazel from the University of Minnesota's Department of Family Medicine and Community Health. Thanks for joining us on ECHO.
Thanks very much for asking me to be part of this.
Absolutely. We appreciate it. This is a very important subject. Why is it so important to our community? Seems like we're getting more and more information on it now.
Well, one of the reasons is that this has been a cancer that has been neglected. We have heard lots about breast cancer, lots about lung cancer, but this is actually a very important cancer that's been under-discussed, if you want to think of it that way. So we're realizing its importance as something that affects the health of people in Minnesota, of all communities. And so trying to raise awareness is one of our major goals.
And it's a preventable cancer. So often we think cancer is always fatal. Not true.
Uniquely preventable in the case of colon cancer, because as the movie we saw just showed, if you find those precancerous things called polyps and remove them, you can prevent that cancer from ever occurring. In every other cancer, we count on finding it early to try to cure it.
All of us are at risk for cancer in one way or the other. Is that true?
Absolutely. It's not a man's disease, it's not a woman's disease, it's a people's disease. And the most important thing to remember is as we get older, our risks of that cancer go up.
Okay. And so we're dealing specifically with colon cancer. What are some of the symptoms that we might want to pay attention to, and what age?
Well, first I want to emphasize that colon cancer, especially in the early stages when we want to catch it, doesn't usually produce symptoms. It's usually the later stages of the disease where we'll have the symptoms, and that's why our message is don't wait for symptoms, get screened when you're old enough to get screened. You might have things like blood in the colon, you might have cramping in the lower belly, you can have change in your bowel habits like diarrhea that lasts for weeks. But those are things that can be associated with other illnesses as well. So just because you have them doesn't mean it's colon cancer, but it sure would be something that means go see your doctor soon.
What are the risk factors for colon cancer? Is this something that, you know, like many cancers, if it runs in the family, absolutely you should be tested because you're higher at risk?
There's some of that. Again, to reiterate, the most important one is age. And because as we cross 50 and get older, the risk of cancer keeps going up, we make the universal recommendation. Everybody who's 50 or older should be screened. Maybe 10 to 30% of all cancers have that family component that you're talking about. And we get particularly concerned if there are larger number of family members that have it, especially if they're close family, your parents, your brothers and sisters, or if they had it at a young age, 60 or younger. Those would be things that would say your family history might mean you might think about getting screened even before you hit 50. But remember that almost 2/3 of all cancers don't have any of those predisposing things like a family history. And so this is a message for everybody, not just it runs in the family people.
So men and women 50 and up should be tested for colon cancer. Is that an annual test, or how often are we tested?
There are different ways of testing. As the film alluded to, there's one that's becoming more common called colonoscopy. That would be recommended every 10 years. And if they find something that looks more suspicious, they might say we need to do it more often than every 10 years. On the other end of the spectrum, another test they talked about was that stool blood testing, and that would be something you need to do every single year. And then there are a couple other tests that might be done on an every 5-year basis.
Clearly the physician can help give some guidance on how often and what kinds of tests.
Absolutely.
But what other things can we do to help reduce our risk of obtaining colon cancer?
Well, what's nice about this message is it's the same one we give for heart disease, for diabetes, for anything else.
One less thing to remember, just all of these things.
Live your healthy lifestyle. You've got to eat your fruits and vegetables, get 5 servings. You've got to be physically active. You've got to maintain a healthy weight. Avoiding smoking would be another thing to do. But those are the kinds of things that are going to help prevent colon cancer for you.
Okay, common themes: maintain weight control, lots of exercise, and that's 5 fruits and vegetables every single day.
Right,
Okay.
if possible.
If I am at risk, wouldn't my doctor or healthcare provider tell me to get tested? Do they not always just say you should probably get tested? Or is it always my responsibility, or is it a partnership here?
I'm a family doctor, and so I see patients of all ages, and I know how other competing needs might push that out or push it to the background. Often, especially as people get older, you have more and more issues you want to discuss with your doctor, and so it might not be high on your list, it might not be as high on my list. But I really like it if a patient's willing to come to me and say, what about testing for colon cancer? Is this something that's right for me? So if your doc doesn't mention it to your doc.
Okay, hopefully those that are watching this broadcast and are young enough too will be able to learn more and ask some questions about it. Some of us, though, are believers that if I'm not sick, why see a doctor? Why get tested?
You're right about that. An awful lot of us won't take our medicines, won't
Right.
see docs for any reason unless they're feeling ill. But the thing about cancer is you can have it and have no outward evidence that it's there at all. As I was saying earlier with those symptoms, the cancer can be present for years before you would notice anything that's going on. So we emphasize screening, looking for a disease that isn't there once you hit 50 to try to find it before it becomes a problem. And if we find it early, that's when we've got the best chances of curing it, and curing it easily for you, the patient.
Like many cancers, too, testing annually keeps you on track and at least gives you more information than you had the year before. All right, we've decided to go ahead and get a colon exam. Is this going to be painful or not?
Well, there are different types of testing. The one that people often are worried about is the colonoscopy. They say, that's a long tube and I'm not sure I want to have that test. The nice thing about tests like that is they're usually painless. There are medicines that basically put you to sleep. You don't feel much, if anything, and you're usually not even aware that the exam has taken place. So the answer to that is no, that test usually isn't a painful test. One of the other tests, the stool blood test, is one that you can do at home, and it's a test that involves no discomfort whatsoever.
Now, this test, the colonoscopy test, am I completely out during the exam, or can I be partially awake? I mean, am I being talked to, or is it a choice?
You'll have some choice in it. Usually people are aware of their surroundings but don't have any memory of it. Okay. It's sort of not the anesthesia like for major surgeries, but the kind of make you oblivious to what's going on kind of anesthesia. Okay.
All right. Well, that's good. Is it about how long does a test take?
It can be relatively short, almost always less than an hour, and quite often less than half of that. You then have a recovery period afterwards. The doctors and healthcare people will be watching you, making sure you're getting enough fluids, that you're recovering well. After that test, you'll usually need someone to take you home because you had medicines, you're sleepy, but you can go back to work the next day, and you're usually just fine after that.
Wonderful. And how soon are the results then?
Almost always within a week. You should be able to get final results. The physician performing that may give you some information the next day. If they took polyps or samples, that would go to pathology, and that should come back within about a week. If they find anything that's suspicious, then they'll talk to you about what the next steps would be.
Dealing with the personal parts of the body in this particular test, it's a personal test. Some people may feel uncomfortable with that whole process. Obviously, it's conducted in a private room with your physician and assistants. But how can you help assure some of the results are, for instance, kept private from HIPAA guidelines in particular, but out of respect and care for those that may feel a little uncomfortable with just the whole idea?
Well, as you were saying, the tests themselves are conducted by people that are professionally made aware of your need for privacy. No one's going to be in those rooms that shouldn't be in those rooms, and everyone should be considered. And if they're not, you should be able to say something. But I haven't heard of those kinds of things happening in these days. As professionals, we're required to keep your health information private. So without your permission, I couldn't even tell your significant other or your spouse these results. Almost always this will be in a face-to-face meeting or something that's mailed personally to you at the address you tell me to. So it's not going to anybody else, and it's not going to employers or other people either.
You mentioned that we will need somebody to drive us home after we take the test. Is there anybody that needs to stay overnight after they take the test?
No.
It's just that simple.
It's that simple.
It's just a precaution. You don't want somebody driving after they've been under a partial anesthesia or anything like that.
Exactly.
Nauseousness or anything like that after the exam, and most candidates?
Most candidates not.
Okay. Well, that's good news. Simple test, less than about an hour, so it's clearly worth the results there. What if I have cancer and those results? Is that a personal phone call? I'm notified by the physician, him or herself?
You will be notified, certainly by a member of the healthcare team, often by the physician themselves. But what will follow will be a series of meetings, both with the doctor, usually who performed the testing, often with specialists, sometimes oncologists, sometimes surgeons. There are different ways to treat these cancers depending on what type and how advanced the cancer is. So you would be meeting with those people and talking about what are the next steps. The thing to emphasize here, though, is that many, if not most, cancers can be treated. Many people are surviving these cancers and living healthy lives afterwards.
You're saying that most people don't seem to have awareness to get these colon cancer tests, and of course we hope this program will raise the awareness, encouraging folks to get it. Is it covered by insurance? Is it a costly exam? I mean, because that might be a factor why people aren't getting tests.
It absolutely is one of the factors. If you have Medicare, it's covered automatically. It's one of the guaranteed results. In Minnesota, every health plan is required to have some sort of coverage, but they can pick which of the tests that they will be covering. Remember, everybody 50 and over needs it, and so if you're insured in Minnesota, we can pretty universally say there will be some kind of coverage for this testing for you. Not everyone may be able to get each of those kinds of options. You may not all have colonoscopy as an option, or X-ray studies, the barium nano studies.
So they allow one test over another, but not universally just
right. But there will be some coverage.
Okay.
You will definitely have coverage covered.
Okay, that's helpful. Where do I find out more about colon cancer? It's a big topic, an accurate source of information so that I can follow up and learn more, in addition to my physician.
Yeah. I always emphasize it, talking to your healthcare providers, the people that know you best. They're a good first source. But second, the American Cancer Society is a really good source. They both have a toll-free number and a website where you can get more information about everything from the tests, what do I need to do with testing, to I've got the diagnosis, what should I do next? It's a wonderful resource.
All right, so the American Cancer Society, local chapters, statewide chapters here in Minnesota and across the country for that matter. Is there anything else, Doctor, that you'd like to add about this subject?
Well, I want to keep this a simple sort of thing. Don't get lost in, gee, there are multiple tests I can do, or gee, what age should I start doing this at? The bottom line is if you're 50 and older, you should be doing something. You should be talking to your physician, your healthcare providers about this, and with them deciding what makes the most sense for you. But everybody who's 50 and older should be doing it. If there's something that you think puts you at high risk, say lots of family members have the disease, or you have other diseases that you're concerned about potentially putting you at more risk for it, then again, the bottom line is talk with your healthcare provider about this and decide, is this needed, and if it is, what's needed for you.
Thank you. Dr. Mark Kazel from the University of Minnesota, Family Medicine. I really appreciate your information. And there's a lot to talk about on this subject matter. Consult with your physician or the American Cancer Society. And for this program, try to remember these three key messages. First, colon cancer is a preventable disease. Second, both men and women are at risk for colon cancer. And lastly, if you are 50 and older, you need to get tested for colon cancer. Thank you very much to my guests for joining us this time, and to you for watching. You've been watching ECHO Emergency and Community Health Outreach. I'm your host, Lillian McDonald. If you'd like more information, please visit our website, www.echominnesota.org. Until next time, thanks for watching.